Welcome back. November is National Pet Cancer Awareness Month. I didn't know that. The LSU School of Veterinary Medicine wants you to know what types of cancers pets can get, some of the signs and symptoms. Here to tell us more is the communications manager of the School of Veterinary Medicine, Ginger Gutner. How are you?
Good, Johnny. How are you?
You doing okay with the time change?
Yeah, so far.
No, I hate that.
I know. It's not great, but you got to live with it.
November is National Pet Cancer Awareness Month, and we're going to talk about some of the signs and symptoms and what types of cancer. And we don't want pet owners to get all nervous if they've got
Right.
a pet that has one or two of these symptoms. So let's just get right on into it. Where do you want to start, the common types or the warning signs?
Well, I think for people, just to be aware of the fact that it's a lot of the same kind of cancers that people can get. So lymphoma, skin cancer, bladder cancer, bone cancer, to a certain extent mammals are mammals. And so, but I think just for people to be aware that their animals can get cancer, and particularly older animals. So just like I think with people, older people, you tend to get more prone to cancer, and older animals too. We see a lot of older animals come in with cancer.
Are certain, without really naming the breed and scaring everybody, are certain breeds more susceptible to cancers?
There are some breeds that are more prone to certain kinds of cancers, and so what I usually recommend, if you're interested in a particular breed or even a type of animal, just do some research. I mean, you won't have to dig down too far to find things, and I think anyone that has any kind of, especially a purebred dog, knows, right? Certain dogs are going to be prone to heart problems, and other dogs will be, like for example, Dalmatians are often deaf. Beagles often have eye problems. So if you just kind of do a little research, you'll find out that there are certain breeds that are prone to certain kinds of cancers.
Yeah, I remember a veterinarian telling me one time that it was not all dogs that are prone to certain types of cancer are going to get cancer.
Right, exactly.
So,
yeah, just like with people, right? Just because it runs in your family, it could skip you, right? It just depends. But there are some, there are some things we can look for.
What are some warning signs or some things? Because we know our pets intimately. We know when there's something wrong.
Yeah, you can usually tell when something's going on. And so I love it. One of the oncologists that we work with says to look for the 3 A's. So changes in attitude, appetite, or activity. So if you see major changes in any of those things, not that we want you to immediately assume it's cancer, but you should probably at least call your veterinarian, right? And I think we all can tell when our pets just aren't really feeling themselves, right?
No question. And the oncology department at the vet school is incredible.
Yeah, we have been treating cancer since 1998. And so we can do it, and again, just like as the types of cancer are similar with people, so is the treatment. It's chemotherapy and radiation therapy. So it's like my linear accelerator that doses radiation therapy is. The linear accelerator is what we use at a human hospital. Ours actually came from a human hospital. The chemotherapy drugs are also the same, the dosages are different, so it's a little bit less.
Did not know that. November National Pet Cancer Awareness Month, but again, I saw bladder cancer on here as well, and bone or joint cancer.
Yep.
It doesn't mean that your aging dog that's having mobility issues has bone cancer.
No, absolutely not. But but if you see them having a little trouble moving around, it probably wouldn't hurt to have your veterinarian just come in and take a peek at them.
You were telling me about Mike the Tiger. One of the Mike the Tigers had an issue that one of the handlers caught.
Right. So one of it was Mike 6, and one of his caretakers, we were talking about, right, symptoms, just had a very slight swelling on his face. So slight that when I was shown the picture, I had to have it pointed out to me. But that caretaker who saw him every day, the first thing she thought was, his face doesn't look right. Because that's one of the other symptoms is if they suddenly have like a lump that wasn't there or an enlarged lump is something you can look for, right? So obviously changes in their physical condition can indicate something is wrong. And so we did have him treated. Wow.
Ginger, thank you for coming on every month and sharing some things with us about our little furry friends. Is Mike ready for Florida?
Mike is always ready.
I love that answer. Thank you, Ginger Gutner of the LSU School of Veterinary Medicine. And we will be right back on 9 News at 9 after a short commercial break. Stay with us.